when ADHD and anxiety coexist, especially in the context of autism, where do we start? What should we target initially? The ADHD or the anxiety? Well, you want to ask, is one of these tendencies primary and the other one secondary, or are they really co-equal, coexisting conditions? So sometimes you have ADHD obviously causing difficulty with performance, difficulty fitting in, and there's secondary anxiety. If you just treated the ADHD, the anxiety would be better. Other times you have anxiety as a primary problem, and if you just treated that, well, then the child could relax and focus better, and they wouldn't have such difficulty with their inhibitory controls. But other times, there's not a clear primary or secondary. They truly coexist. So I'll ask parents the magic wand question. If you could only have one magic wand, what would you wave it over? The ADHD or the anxiety? Remembering we don't have a medication for autism per se. We're just using medication for either of those two issues, ADHD or anxiety. And sometimes parents will say, well, clearly I'd like the magic wand, doc, for the ADHD, or clearly I'd like it for the anxiety. And then that's what we go with. They have a good feel for what's going to be the most bang for the buck, what's the core issue and what's the secondary issue. Other times parents say, I don't know, I kind of need two magic wands. They seem to be equally important, and it's hard to decide what to target. Well, then what do? We can look at developmental history and ask, which came first? The ADHD developmentally, were there obvious signs of poor impulse control, distractibility, hyperactivity early in life, and anxiety only came along after the child had experienced their ADHD for some years? Or is it the other way around? Early in life, there was obvious evidence of avoidance, of irritability, of inflexibility. There were mood regulation problems, and the ADHD came along afterwards. Now, that kind of thinking is sometimes helpful, but sometimes it's not reliable because kids will show different problems at different ages depending upon their developmental phase. So, ask about developmental history, but don't hang your hat on it in terms of identifying primary and secondary problems. How about family history? Well, sometimes if the family history is loaded for ADHD, if there's tons of relatives with ADHD diagnoses or tendencies, that might lead you to assume that should be targeted first. There's more genetic loading for ADHD than anxiety. On the other hand, if the family history is loaded with anxiety, well, then you might consider that as the more likely primary condition. But sometimes that can be misleading too, because children will have different phenotypes than genotypes. They will show self-control problems in ways that might not be the same as their parents or their aunts and uncles or cousins. But it's still a consideration. When in doubt, it's a coin toss, then you might, as a practical matter, start with medication for ADHD because that is the treatment of choice for ADHD, and cognitive behavioral therapy for anxiety because these have the strongest evidence base. The treatment of ADHD usually involves medication. The treatment of anxiety, not necessarily. You can often treat anxiety without medication. So that can be a tiebreaker, just the evidence base in terms of effectiveness of interventions. So that's strong evidence base. The practical consideration also of what's going to be quickest. You can do a stimulant trial for ADHD in pretty short order. That usually is a few weeks to get a feel for how much that's going to help. And on the other hand, getting in with a skillful cognitive behavioral therapist, once in, giving it the months to see how that's going to work, it just takes more time. So it's easier and quicker if you're in doubt to go with the ADHD management first, again, if all else is equal and you really don't know which is primary and which is secondary. You have true coexisting conditions.